Across the world, from the vast sun-drenched African savannas where wildlife roams free and communities rise with the dawn, to the dense, humid rainforests of Asia where the air is thick with life and danger lurks beneath the canopy, venomous snakes remain a persistent and often underestimated threat to millions of people. Every year, nearly 2 million people are bitten by snakes, making snakebite a hidden public health crisis that quietly devastates families and communities, especially in the world's most remote and vulnerable regions. The victims are often rural farmers tending their crops, children playing near tall grass, and people simply going about their daily lives, unaware of the danger that may be hiding just out of sight. For these families, a single bite can change everything in an instant, turning a normal day into a desperate struggle for survival and hope. Climate change is making things worse, pushing snakes into new territories as their habitats shift, increasing the risk of unexpected encounters and putting even more pressure on already fragile healthcare systems that struggle to keep up. Surviving a bite can mean living with permanent disability, the loss of a limb or chronic pain, outcomes that can forever alter a person's life and their ability to provide for their family. The economic impact is devastating, especially for families already living in poverty, who may lose their only breadwinner or face overwhelming medical costs that push them deeper into hardship. The burden of snakebite falls hardest on those with the least access to care, people in remote villages who must travel long distances for help, often with little hope of timely treatment. Yet, in the face of this crisis, there is hope. Advances in modern medicine and new research are giving us powerful tools to fight back, offering the promise of better treatments and faster responses. The battle against snakebite is about more than just survival. It's about protecting livelihoods, keeping families together, and strengthening the fabric of entire communities. The search for better, more accessible treatments is urgent and ongoing, driven by scientists, doctors, and local heroes determined to make a difference. This is a story of resilience, hope, and the unwavering quest for a safer, healthier future for everyone, no matter where they live. For over a century, antivenom has been our main defense against snakebites. Made by injecting animals with venom and harvesting their antibodies, antivenom has saved countless lives, but it's expensive, difficult to produce, and requires refrigeration, making it hard to deliver to remote areas. Many rural clinics lack the cold chain needed to keep antivenom viable. Because it's derived from animal blood, antivenom can trigger severe allergic reactions, sometimes as dangerous as the bite itself. It must be given by trained professionals in hospitals, often far from where bites occur. Antivenom is also species-specific, so clinics must stock multiple types, increasing costs and complexity. In many regions, shortages and poor quality products lead to preventable deaths. The limitations of antivenom leave millions at risk. The world needs a simpler, safer, and more accessible solution. The search for that solution continues. Hope lies in innovation. Scientists have discovered a surprising new ally in the fight against snakebite, Unithiol, a medication that could change the way we respond to one of the world's most neglected health crises. Every year, hundreds of thousands of people are bitten by venomous snakes, especially in rural and low-resource areas, where access to life-saving treatment is limited. The search for a solution has led researchers to look beyond traditional antivenoms, and Unithiol has emerged as a promising candidate. Originally developed to treat heavy metal poisoning, Unithiol has a unique ability to neutralize some of the most destructive components in snake venom. Its chemical structure allows it to bind to toxic molecules, potentially stopping the venom's deadly effects before they cause irreversible harm. Unlike traditional antivenom, which must be injected and requires trained medical staff, Unithiol is a pill, simple to administer, even in the most remote settings. This means that people far from hospitals could receive treatment within minutes, not hours. It doesn't require refrigeration, making it ideal for rural clinics and mobile health units that often lack reliable electricity. This stability is a game changer for communities where cold storage is a luxury. A community health worker could give the first dose right at the scene, buying precious time for victims who live hours away from the nearest hospital. Early intervention can mean the difference between a full recovery and lifelong disability. Unithiol's stability and affordability make it a practical solution for low-income countries where the burden of snakebite is highest and resources are stretched thin. Its low cost could allow health systems to stockpile it for emergencies. It represents a paradigm shift, a broad-spectrum treatment that's cheap, stable, and easy to use. For the first time, there's hope for a universal approach to snakebite that doesn't depend on cold chains or specialized training. Unithiol isn't meant to replace antivenom, but to work alongside it as a first line of defense. By slowing the venom's effects, it can give patients a fighting chance until they reach advanced care. It can stabilize patients and prevent irreversible damage while they are transported to hospitals, especially in regions where ambulances and roads are scarce. This simple pill could transform snakebite treatment worldwide, making effective care accessible to millions who have been left behind. For millions, it could mean the difference between life and death, between hope and despair. The future of snakebite care is changing, and Unithiol is at the forefront of this revolution. Unithiol brings hope where it's needed most, offering a lifeline to those who have waited too long for a solution. Snake venom is a complex mix of proteins and enzymes, with some of the most dangerous being SVMPs, enzymes that cause severe tissue damage and bleeding. These enzymes rely on zinc to function. Unithiol acts as a chelator, binding to zinc and disabling the venom's destructive power. By removing zinc, Unithiol stops the enzymes from breaking down tissues. Unlike antivenom, which engulfs venom proteins, Unithiol targets the venom's most dangerous weapon at its source. This targeted action makes Unithiol effective against a wide range of vipers across Africa, Asia, and the Americas. A single medicine could help treat bites from many different snakes, even when the species is unknown. Unithiol offers a universal first response tool for snakebite emergencies. It's a new approach, precise, effective, and adaptable. The potential impact is enormous. Before Unithiol could be used for snake bites, its safety had to be proven. In 2022, researchers in Kenya conducted a phase 1 trial with 64 healthy adults. The results were clear. High-dose oral Unithiol was safe and well tolerated, with only mild, temporary side effects. No serious adverse events occurred, and the risk of allergic reactions was much lower than with antivenom. This strong safety profile paved the way for further studies. Researchers established a 3-dose regimen to maintain protective drug levels for 24 hours, ready for the next phase, testing in real snakebite patients. The safety trial was just the beginning. Next, phase 2 and 3 trials will test Unithiol in real snakebite victims, comparing it to standard treatments. Researchers will determine if Unithiol reduces tissue damage, prevents bleeding, and saves lives. Trials will include children and be conducted in the countries most affected by snake bites, ensuring real-world relevance. The goal: gather enough evidence for global health authorities to approve Unithiol as a first-line treatment. If successful, Unithiol could be produced and distributed at scale, reaching millions in need. The journey from discovery to cure is underway. In rural Kenya, snakebite is not just a rare occurrence, it's a daily threat that shadows the lives of millions. Every year, up to 20,000 people are bitten by snakes across the country, often while working in fields, walking to school, or tending to livestock. Tragically, around 4,000 of these bites result in death, leaving families and entire communities devastated by loss. For many victims, a snakebite marks the beginning of a long, desperate journey. With clinics often miles away, families must carry their loved ones over rough terrain, hoping to reach help in time. Even after reaching a clinic, there's no guarantee that the right antivenom will be available. Stockouts are common, and some clinics lack even basic supplies. The cost of treatment can be overwhelming, plunging families into debt and forcing them to make impossible choices between healthcare and daily needs. But imagine a different reality, one where every rural clinic is equipped with Unithiol pills, ready to be used at a moment's notice. In this scenario, a trained health worker could give the first dose immediately, right at the point of care, without delay. There's no need for a doctor, intravenous lines, or even refrigeration, making treatment accessible in the most remote areas. The pill would begin working quickly, blocking the venom's deadly effects and stabilizing the patient, buying precious time. Suddenly, the frantic race to the hospital becomes less desperate. Families can travel with hope, knowing their loved ones' chances of survival have improved dramatically. Unithiol empowers entire communities to act quickly, reducing the risk of disability and death. It brings life-saving treatment closer to home, decentralizing care and making it more effective. This approach makes critical care not only accessible but also affordable for families who need it most. For thousands living in remote areas, this could mean the difference between keeping a limb, regaining independence, or even surviving at all. It's about preserving livelihoods, keeping families together, and allowing people to return to the work and lives they love. Unithiol directly addresses the barriers, distance, cost, and lack of resources that have made snakebite so deadly for so long in Kenya. It's a true game changer for Kenya, with the potential to inspire similar solutions across Africa and beyond. With innovations like Unithiol, the future of rural healthcare in Kenya could be transformed, offering hope, dignity, and a new standard of care for generations to come. In 2019, the World Health Organization set a bold goal: cut snakebite deaths and disabilities by 50% by 2030. Achieving this requires empowering communities, improving access to treatment, and strengthening health systems. Unithiol fits perfectly into this vision, a simple oral therapy that can reach the hardest-hit communities. It reduces pressure on hospitals by enabling early intervention. Unithiol empowers people to seek care quickly, knowing help is close at hand. This innovation could make the WHO's target a reality. Unithiol is the breakthrough the world has been waiting for. Unithiol is more than a scientific breakthrough, it's a story of hope. It means a child can play without fear and a farmer can work without risking everything. For millions, this pill could turn a deadly bite into a treatable emergency. The journey began with a simple question: what else can this old medicine do? The answer could save thousands of lives every year. The next trials will be the true test, but optimism is high. Unithiol represents justice and equity in global health. No one left behind. It's a beacon of hope in the fight against snakebite, lighting the way to a safer world.